Hey everybody, good morning. This is Anna Achimowicz from Performing Arts Medicine Center over here in the home office, in the home practice. I'm checking up with you again to ask how all of you guys are. How are you managing your health and your shape for whenever shows kick back in so that everyone is back on stage, healthy, fit, and in the most of possible best physical stamina, psychological stamina, and especially nerve system stamina. I wanted to touch up on one super cool topic. I get that a lot from all of my clients, all of my patients, all kinds of musicians, athletes, physical performers, like dancers. And sometimes if you worry and you think, why the heck is your shoulder hurting, or why is your knee giving in even with tons of training and tons of exercise, let me just tell you that the base starts at the base. So pretty much that goes for the pelvis and for the whole central region of the body. And man, however much you exercise and push and force, it's not going to work. You're not going to have effects or results. You're going to be super frustrated, if not even develop an injury that is gonna later require physical therapy, all kinds of chiro, manual adjustments, even seeing a specialized doc in orthopedics and traumatology, and that of course we want to avoid. But speaking of the pelvis, you know, when you play an instrument, when you just practice at home, you kind of jam along, you develop all kinds of patterns that you're not aware of, and very often, which is also what I teach in my body management courses and seminars, and also one-on-one working with guys like you, hands-on, with all of the tools that I'm using. Super quick and super efficient. It's easy to find the cause and the chain reaction, and very often we do not feel that chain reaction up until we get some kind of carpal tunnel, elbow pain, shoulder pain, and that pretty much comes from, you know, playing regularly. There is the wear and tear factor, but more than anything, there is the problem with something being misaligned that then later affects all of our effectors, meaning the nerve system, which then also supplies the muscles themselves to do any kind of function, be it rocking out on stage, dancing, performing, running a sprint, or playing a 2-hour gig on stage. So yeah, that's pretty much one of the things. If anything is not aligned in the pelvis, and that could be a million reasons or directions, then later on it's going to affect throughout the body. It's kind of like the bass amp, you know, or guitar amp, if you will, plugged in halfway. No electricity is going to go through because there's something in the way, right? And that might be the misalignment of any body element, of a joint, of a nerve, of a muscle that creates extra tension. The nerve system then goes, colloquially speaking, out of whack because it's trying to find a way and weird pattern to do so, and the end result isn't so great. You might feel that it does not affect your performance, it does not affect your playing, but in the end, it does end up with a weird kind of pain that you just cannot shake off. It's not due to bad sleeping position, you know, an uncomfortable pillow if you're on stage, on tour, as a touring performer, touring musician, but very often it's weeks and weeks and months of developing that kind of move, and then the massage is not the way to go. Any kind of manual work is gonna just relieve stuff for a day or two, but it's not gonna fix the problem. And why NCMT and all performing arts medicine methods that I pretty much use hands-on most with you guys, helping you out with managing that, is finding the cause and then going from the cause to the problem itself, and it's usually within a couple of minutes. Then maybe an exercise or two as homework to kind of sustain the activation of the nerve system, of the musculoskeletal system, of the circulatory system, just as a kind of home message to send you guys on your way. But that, of course, in each case is super individual, that I always check out. I test first, and then we go from there. What you need exactly, be it being a professional 20, 30, 50 years in the game, or just starting off wanting to build up your professional career in performing arts, whatever that might be, ballet, rock and roll, violin playing, or heavy extreme weightlifting and marathon running. So whichever one. So hope that little tip and info is interesting for you guys. I'm going to check in a bit more with these small little live streams. Of course, if you need special individual attention and help, please don't hesitate and hit me up through the contact buttons, Performing Arts Medicine and Dance Medicine Central, or just look up the name Anna Achimowicz Physio and Cairo and all of that manual stuff. Someone for sure is gonna contact you from the office and book your individual consult and training and individual coaching that I'm more than glad to share with you guys and also do with you guys. So yeah, until then, stay safe, everybody. Stay fit, stay hydrated. If you binge on a lot of coffee and other drinks, it's always good to get those levels in. So yeah, in other words, have a great Sunday to everybody. November 22nd, middle of autumn, and it's getting a little bit colder. It's getting a little bit more demanding to work outdoors. So if you're training even more intensive inside your own houses, also hit me up on that for any extra help so that you don't develop any wrong patterns and any problems with that, because an exercise or two gone wrong can develop a nasty, gnarly problem that it will require manual rehab, and that these days isn't so easy. So let's try to keep it small, shall we? In the sense of self-harm. So anyway, guys, great stopping by. Hope everyone is well and safe and sane as always. And until next one, I'm gonna do more of these little check-ins with a little bit of more cool information that you, I think, might find interesting and helpful. So until then, see you guys. And thank you for stopping by Performing Arts Medicine Center with yours truly.